Hi, Dr. Larry Altshuler here, back to you about healthcare and healthcare reform, and telling you things that you won't hear from the media and you certainly won't hear from the politicians. Now, I've had a lot of these videos talking about the Affordable Care Act and how it really is not a good act, and it's really not going to help either in decreasing costs or improving the quality of care. In my first video, I mentioned that I was nonpartisan. And I mentioned that the Republicans really don't have much to offer health care reform as well. In fact, most of the Republicans simply want to repeal the Affordable Care Act. But the health care reforms that they want to do really won't get rid of the dysfunction in our system. The purpose of this and my next video is to tell you exactly why this will be. So let's get started. Now, there's three primary reforms that the Republicans have had for a long time, and all the Republican candidates have these as well. So let's talk about it. Number one, buying health insurance across state lines. Now, what that is basically is that all states have mandates that they put on insurance companies, and each state has different mandates that their legislatures pass. The problem with these mandates are that every time you tell the insurance company you need to cover this or cover this, then it increases the cost of premiums. So the purpose of buying insurance across state lines means that anyone in the United States can look for an insurance policy somewhere in another state that doesn't have all these mandates and so won't be as costly. So that's the principle. But in effect, it's not really going to work. Number one, let me just say that many of these mandates are actually very important and they're good to have. Remember, you have to have balance in any good insurance system because the healthy and unhealthy have to have a balance so that people can get services covered that they may have a medical condition, whereas someone else may have a different medical condition. But you want to cover both of those, so all of them together you can balance it out. Well, number one, if you don't have these mandates, you're not going to have that balance, and some people are going to find that they can't be covered, and they're going to have to pay out of pocket for these very expensive medical conditions. Well, that also applies to the entire system that the Republicans want. Again, the balance. Because really, when you think about it, what this is going to achieve is beneficial only for healthy people. Because it is healthy people who are going to try to find insurance policies that are basically bare bones. They don't have all these mandates and all these services, that just have the basic benefits package. The problem is that people who are unhealthy or have pre-existing conditions or who have lots of medical conditions, their policies are going to be much, much more expensive because all these healthy people are just going to buy the bare bones policies and leave them to deal with the insurance companies themselves. So right now, there's going to be a tremendous imbalance. The healthy will benefit, the unhealthy, the pre-existing conditions won't benefit at all. But in actuality, the people that are healthy now will also not benefit in the long run. What happens if you buy insurance across state lines, you have a bare bones policy, and then you get sick? What you're going to find out is that that policy isn't going to cover this other sickness. It's going to have limits to it. And so you might find out that you're not covered at all. You're going to be underinsured. So from both aspects, buying insurance across state lines is not going to work. It's going to tilt the expense way toward people who are unhealthy or have pre-existing conditions. And in the long run, it's not even going to help those people who are healthy. Well, that's the number one issue that the Republicans think will help reform the system. What's number two? Well, that is giving tax credits. The basis for this is that employers get tax breaks by giving insurance to their employees. And so now the Republicans say, well, everyone should be able to have this and have tax write-offs and tax benefits to make it more affordable. Now here's the first problem. It doesn't make it more affordable. Say that you are a consumer and you're going to buy a health insurance policy and you get a tax write-off, say a couple of $1,000s. Well, that's great. But someone's going to have to pay for that couple of $1,000. Just because you're getting the tax credit, it still is going to cost money. Well, what's happening is the government is going to subsidize that. But you are the government. You are the taxpayer. So on the front end, you're going to get a tax break, and on the back end, you're going to have to pay for it because taxes are going to have to go up to pay for all those subsidies. So that's not going to work. But number two is the proponents of this system will tell you that by doing this, again, tax breaks, consumers will look into the insurance more and realize what health really, healthcare really costs, and make concerted efforts to make sure they get the lowest cost benefits. Well, I'm here to tell you that that's absolutely untrue. That's not going to happen. There is nothing in tax credits that are going to incentivize consumers to make sure they're getting the most cost-effective health care. Remember, they're still buying insurance. If they're going to pay for insurance, they're going to want everything that they can get from that insurance policy. And insurance companies, as I have told you previous videos, they're the main drivers of healthcare inflation. They pay for waste. They pay for unnecessary, ineffective treatments. Well, the consumer that buys these policies aren't going to know what's effective and what's not effective. They're going to go to doctors who are going to order all these tests, specialists who are going to order a test, and a lot of these are going to be wasteful. There is nothing in this reform that's going to help consumers look at the policies and get these better policies and know what's cost effective. So this isn't going to work at all. Number three on the Republican list is malpractice reform. Now, malpractice reform is good because we pay 11% of the healthcare budget on defensive medicine, and that's a lot of money. A lot of money. So if we can decrease that, that'd be great. But the Republicans have one way of doing this, and that is putting caps on the awards and on damages. And by putting those caps on it, it decreases the cost of malpractice insurance. Well, that's all great for the doctor because it will decrease their premiums. But it does not motivate them to change anything else. In fact, if anything, they'll be more likely to commit malpractice because they know they're not going to have to pay as much. There is no incentive for them to decrease errors, to decrease malpractice, to decrease defensive medicine, or to change their practice in any way. Putting caps simply decreases the cost of malpractice suits and decreases their premiums. It doesn't help anything else, does not help healthcare costs, it doesn't help quality of healthcare. So these three reforms, which are the major reforms for the Republicans, buying insurance across state lines, tax credits, and these caps for malpractice reform, none of them are going to be effective and make a dent in the dysfunction of our healthcare system. So that being said, there are some more things that the Republicans have, some other reforms, which will be the content of my next video. Until then, if you want to find all these videos, I urge you to go to my website, balancedhealing.com. And by the way, you will find a lot of information on medicine and healthcare that will really help guide you and navigate through the healthcare system and find the most cost-effective treatments for you, no matter what the politicians think and are trying to do. So until then, thank you for listening to me, and I hope you'll come back and see the other videos as well.